Have you been diagnosed with a rotator cuff tear and been told you need surgery? Well, I'm here to tell you exactly what you need to know. My name is Dr. Aaron LeBauer with LeBauer Physical Therapy, and I'm a doctor of physical therapy and knee pain expert. And this is my friend, Dr. Nielsen.
Kaizen Physical Therapy here in Durham, North Carolina.
So we've seen a lot of people with rotator cuff tears. It's very common to have a rotator cuff tear when you're over the age of 25, even 20. It's something that a lot of people have. And the problem is when you have shoulder pain and you go get an MRI, you know what they're going to find?
Something.
They're always going to find something. Rotator cuff tear, some arthritis, and something this and something that. You know, I had a friend who had a rotator cuff tear and was told, you need surgery. You know what? Yeah, you may need surgery, but there's a couple other things that you should do first.
You should come see a physical therapist and get a full body exam, because a lot of times, now if it's a true rotator cuff tear that's the problem, the thing you're going to be suffering with is not having functional movement. So you're not going to be able to lift your arm overhead, because if it's a rotator cuff tear, the muscle is going to be fully torn and it's not working. So it's not about the pain. It's about the amount of movement you have with your arm. If you physically can't move your arm, then maybe the torn rotator cuff is the problem.
Right. There's also different types of tears. So there can be kind of like an abrasion or like on an MRI, which is very specific, we can say, oh, there's a couple frayed spots, or there's a couple wrinkles, or it's completely torn. So what we're talking about is like if it's completely torn, then the muscle can't work. That's different than if you have a mild tear or an irritation of your shoulder and you can still raise your arm overhead, and then maybe you have a tear, maybe not. Does it really matter? There have been studies done of Major League Baseball pitchers who are throwing 90 miles an hour, have no pain, nothing's wrong with them, they're still pitching however they want. And a majority of them, like over 85% of them, had a rotator cuff tear when given an MRI. And these were people without pain or symptoms. So whether you have a rotator cuff tear or not, the problem may not always be the actual tear. So there's no need for alarm, or don't be worried if someone says, oh, you've got a tear. I had a patient who was told his shoulder was shredded. I mean, he can still raise his arm overhead. He can still do a lot of things. And being told his shoulder was shredded just makes the pain and problem worse. So what can we do about it instead?
So we have to look at least at 3 areas. When you're told you have a torn rotator cuff and you have shoulder pain, we have to look at least 3 areas. We have to look at your neck, we have to look at your shoulder, and we have to look at your upper back and see how everything's moving, because those 3 areas really work together when it comes to movement. And if we want to find a resolution to this, we have to at least look at those 3 areas. Now, if you come and see us, we're going to look at the entire body, because we realize how the entire body really works together. But if you go somewhere else and somebody looks at it, don't just have them look at your shoulder. Make sure they look at your neck and your upper back as well.
Right, and that's one of the common problems that a lot of our patients have had when they've been to other places, that they're only working on just the shoulder and therapy's not working, or it's not lasting, or they're getting some better, or they're not getting better at all. Had injections don't help. Well, it's probably something like upper back or neck that's the problem. But a lot of people don't have the time to do that. And that's what we specialize in, is looking at your whole body and helping you get back to the activities and movements that are most important to you, whether that's picking up your kids or pressing 150 pounds overhead. So what should we do next?
If you've been told that you have a torn rotator cuff and you're wondering if that's really the problem, go ahead and click the link below and let's get on the phone. You can talk to myself or Dr. LeBauer, and let's talk more about the symptoms. What's making it better? What's making it worse? Your past medical history. If you tried PT, chiropractic, or what you've tried to find a resolution, and then we can take that one step further and get you in and give you a full body exam and see exactly what's going on, so we can get a clear picture and save you. Our ultimate mission is to save people from unnecessary surgery, and this is one of the areas that we see the most people being diagnosed with a torn rotator cuff, that they have surgery and then they come out of surgery and their pain is still there. They don't feel any better. So we're making this video because we want to save people from that. So if you're watching this, please reach out to us if this matches you, and let's get you on the phone and see if we can help.
All right. Just remember, physical therapy is not just post-surgical rehab. We can actually prevent surgeries. We can prevent you from losing time in the activities that you want to spend your time in. We can help you get back there quickly and fix the real problem, which a lot of times is somewhere other than the place that you've been told is torn in your shoulder. So click the link below, and we look forward to speaking with you soon.